Hi, my name is William Sivitz. I am Emeritus Professor of Internal Medicine in the Division of Endocrinology and Metabolism. I've studied diabetes for more years than I can count, approaching about 50 years. What is diabetes? Most diabetes is classified in one of two ways, either type 1 or type 2. Type 1 diabetes is somewhat less common, but can be more severe, since type 1 diabetes is the type where the pancreas can no longer make any insulin. So patients with this disorder must take insulin all their lives. Type 2 diabetes is somewhat different. Insulin may be somewhat deficient, but the main problem is that insulin does not work well in people with type 2 diabetes. We call this insulin resistance. Many patients can be treated with diet or oral medications or injectable medications other than insulin. Some do require insulin. What does this have to do with MASLD? MASLD is extremely common in type 2 diabetes. It probably affects about 70% of individuals, although many, if not most, do not know that they may be developing this or already have it. Much less is known about MASLD and type 1 diabetes. It's been studied in many studies that are small, involving different means of assessing for MASLD. The incidence was probably only about 20%. However, this data is, although many studies, they're all small and it's been sparsely studied. Therefore, we looked at this in a large group of type 1 patients. I am a member of the Diabetes Control and Complications Trial / Epidemiology of Diabetes Intervention and Complication Study, DCCT/EDIC. This study involved about 1,400 participants and began actually in 1983. The participants at that time were only 13 to 39 years old, and we're still following over 1,000 of these individuals. We continue to follow these patients even now, about 40 years later. What we found is that 36% of these patients do have MASLD. We found this by scanning the liver with something called a FibroScan. The FibroScan looks for liver fat and for liver stiffness, which is an indicator of fibrosis. If individuals with MASLD go on to develop fibrosis, they become at risk for hepatic failure and even, in some cases, hepatic carcinoma. So it's important to identify this in type 1. And as I said, 36% of our individuals, 742 of these that had our FibroScans done, had evidence for fat accumulation in the liver. 11% actually had evidence for fibrosis. So it's important to identify these so we can begin treatment early and prevent some of the more severe complications like end-stage liver disease or hepatic, meaning liver cancer. So again, very important to identify them.